I'm Peter Block for On the Scene here at the American Heart Association annual meeting in Chicago. With me is Anand Rohatgi from Dallas, and we're talking about cholesterol and cholesterol transport, really, aren't we, Anand? So you have done a trial about cholesterol transport, and I thought, really? And yet what you tell me is pretty interesting. So tell me about your trial.
So we measure the ability of patients' plasma, their HDL, to accept cholesterol from macrophages, and we measured this in 3,000 participants in the Dallas Heart Study. And what we found was our striking inverse associations with incident cardiovascular events.
So this is really a macrophage efflux kind of study, isn't it? Sort of a different way of looking at how cholesterol is moved about. Tell me exactly what you did.
That's correct. So we measured the functionality of HDL, and what we did was we grew macrophages in plates, and then we labeled those macrophages with cholesterol. We incubated the macrophages with patients' plasma, and then we quantified the amount of cholesterol that moved from the macrophages to the patient's plasma, their capacity to accept the cholesterol.
So the ability to move cholesterol around in the macrophages is really what you were testing. And what's the analysis really show then?
Our analysis shows that there was a striking inverse association between increasing levels of efflux capacity and incident atherosclerotic events.
So the more that they can move around, the more the efflux capacity goes up, the lower the event rate, is that correct?
Yes, the higher the efflux, the more protective it was in the development of events.
Okay, so tell me what this translates into real life. I mean, we see a lot of patients, for example, that have high cholesterol and yet don't have coronary disease. Is that somebody that might have ability to really move cholesterol around well with high efflux capacity?
Yes, that's a distinct possibility. The cholesterol levels and HDL cholesterol levels do not track with this functionality measurement, so it becomes very important to actually assess what the HDL is doing.
Okay, so in the long run, do you think this is something that we might use? I mean, we might use it clinically, of course, but is this some kind of a test that's easy to do, or what are you going to do with this information?
I think our next steps are to validate this in other populations and then also see if it can serve as a reliable surrogate for investigating the benefits of novel lipid-modifying therapies.
Perfect. So for me anyway, check on this teaching point, Anand. If you have a patient that has high cholesterol and crazy numbers that you think would be high risk and yet don't have any coronary disease, maybe this is the answer, that they have high efflux capacity, and maybe we could test for that in the future.
We are cautiously optimistic.
It's a good way to put it, and there's the teaching point. Thank you, Anand.
Thank you.